international, ICD, International Classification of Diseases. Every country in the world uses some form of coding to report back to the World Health Organization what they're seeing as causes of death in disease. Everybody, except the United States, has converted to some form of ICD-10. Look exactly what we're using here in this country, no. Because they do make modifications country by country on how they use the codes. You're allowed to do that. Here in this country, though, the first person to actually convert to ICD-10 was back in 1999. Australia did it then, Canada did it then. And most of the other countries have converted along the way to something like it. We will be dead last. The reason for that is, here in this country, we use it for what? Payment. Most of the rest of the world doesn't. Think about it. England, Germany, all these countries have some type of nationalized health, so payment is not a big deal for them. Here in this country, it is. So the scheduled date is October 1st of 2014, and we're all keeping that in mind with our curriculum and working with our faculty and everything, trying to get everything ready. So how big a deal is it? Well, currently for the diagnosis code we talked about, there's about 15,000 codes that we use in ICD-9. When we go to ICD-10, there's 70,000.
Already graduated, and before this whole ICD-10 comes out, they have to go and retake a certification to get.
Well, it depends. When we talk about certification, I'll get to that. It depends. But there's about 70,000 codes in ICD-10. When I talk to physicians about this, they say, oh, you're going to retire. I said, I'm jealous. I would love to think I could retire October 1st, 2014. Not going to happen. Then I remind them 1/3 of the changes. Right now, ICD-9 does not use left side. They don't tell you the left side of the body or the right side of the body that you have a problem with. 1/3 of the changes add laterality, left and right. Some of the changes add information about the stage of the disease and those types of things that physicians know all the time and incorporate in your documentation already. So how will the codes look? Right now, all the diagnosis codes are 3 to 5 digits. 3 digits before a decimal and up to 2 after. You have to have 3 and a decimal. You can have 4 or 5. The more specific you can be, the better. And there are a couple of codes that have alpha characters. We won't get into why, but in the ICD-10, it's going to 7 characters. The first character will be a letter, not a number, and all the rest can be numbers or letters. So, if you have a little more flexibility there to add new codes, a lot more flexibility. So the idea behind this is we'll never run out of the room to add something if we need to. New strain of flu. You've heard about the cruise ship out there that has a new version of the norovirus. 700 people immediately sick with it. We don't have a code for that yet. They will add one, I promise you, when they find out exactly what it is. And the CDC is involved in that. Now, here in this country, the National Center for Health Statistics, which is part of the CDC, is the one responsible for ICD-10 codes, as well as ICD-9 codes. And they work with CMS, or for Medicare and Medicaid Services, for modifications in this country to those codes. And when they work with the World Health Organization on an international basis, that's kind of how it works. Does that make sense? It's a lot of info, I know, but if you have questions, don't hesitate to let me know down the road. And things will come up where you'll have questions, I promise. So this is an example. Patient's been in the hospital to have a pressure ulcer. Right now there are 9 codes. It depends on the location of the body. And ICD-10, there are 150. Here's an example of a few of them. So, left, right, I told you about that, right? Stage, as well as the location on the body. So it goes very differently. I will tell you this, my coders, when I talk to them about it, they say, it's going to lead me to the right code. I'm like, that's the point. That's the whole point. So, certification, why is it important? Again, like I mentioned the other day, it's recognition that you've gone that extra step to show that you're competent in a particular area. And we do have certifications where we recommend for most programs. We've got one that's in flux right now, but we will get to that too. So for NBC, what we recommend, and NBCA as well, is a certification through the American Academy of Professional Coders called CPC, Certified Professional Coder. The exam is 5 hours and 40 minutes, 150 multiple choice questions, a number of them are cases. You got a case that you have to provide all the codes for. There can be 3, 4, 5 codes required to completely code that case. So it's not easy. It was not meant to be easy. The overall pass rate, we tell people, okay, do you know what the first time pass rate is with BARD? About 80%, first time pass rate. Do you know what the first time pass rate is for the CPA exam? About 12%. First time pass rate for this is somewhere in between. They call it 80. They don't release that number. Students who really are diligent and study, work through the mock exams we provide for them, do pretty well on the exam. But we don't have as many participating in this, of course, as we would like. So we try to make sure that everybody's aware of it. Don't tell them it's easy. It's not. Now, there is another exam that is comparable to this from a HEMA. If you ever have a student get back to you and say, but they want to hire me and I need a HEMA certification, call me, we'll talk. The reason I say that is the HEMA certification, well, it's only 120 questions, it's only 4 hours, it's multiple choice. The 20 of the questions are multiple answers. You have to have more than one of the A's you need in order to get the right thing. And it's filling the blank. Without being filling the blank questions as well. They don't tell you how many codes you have to have to get it right. So it is comparable, but to me it's more complex, more difficult. So if they have to, call me, we'll talk. Go and get the CPC first. Because then you'll have that, and then we'll talk about the other certification. Now, with MAA and MOS, we highly recommend that they get the certification as well. The one we recommend for MAA, the MAA program is CMAA, Certified Medical Administrative Assistant. One we recommend for MOS is Certified Building and Coding Specialist. Now, why do we recommend those? Well, MAA is kind of obvious. You're getting involved in administrative things in the office. With the billing, you don't have to have one, but it does, again, show that you've done that extra level, and so we highly recommend the students do it. Now, I will say, with AAPC, there's a membership, you have to be a member in order to get the certification. If they go through us, through our certification services department, we are an approved school through AAPC is the best way to voice it. They can get discounts. We can help them get that membership cheaper. We can help them get the exam cheaper. It saves them about $60 to get on the day. We don't pay for, there's only 2 we pay for, and I'll get to that in a minute. See, NBC we don't pay for, these we don't pay for. Now, I will say too, there's something new out there. You know, we teach electronic medical record. I mentioned reading the other day, and we'll talk more about that now too. But there's criteria for electronic medical records. If you're participating in these federal programs where the federal government is helping organizations pay for their electronic medical records, or a new one, or an upgrade to a system. And so far, they have an article already the other day. They paid out over $16 billion since 2011 to hospitals and other eligible organizations and help them implement electronic medical records and improve them on what they have. $16 billion, a lot of money out there. And as people are doing this, there's stages. And some people are going into what's called stage 2 now. In some organizations where they have people entering orders for x-rays and for pharmaceuticals from the physician's office or other labs and other services, and they're entering those orders into electronic medical that automatically transmits it. It's called computerized order entry. They're looking for the person entering that record to be certified. Entering that order. And I think it's going to hit our ground programs for the clinical staff more than anything, but we're paying attention to it right now. And we do expect to have organizations getting in touch with us. And if you know somebody that's working in the healthcare industry and they're not certified and you want to get a certification, it might be something that you could recommend you when they help them go through a program, be eligible to sit for a certification. Now the grounds, they have different certifications they recommend for all their ground programs as well, just so you know. But I do think certification is going to be more and more important down the road because of that. So for healthcare management, that's the one it's kind of up in the air right now. There's some changes in the industry. There's a new certification that we think is more appropriate for our students. But we want to make sure that the material in the classroom is the right material before we recommend it. So right now we're telling them, there are a couple of certifications and we talk to individual students about it. And if you have somebody who is a healthcare management graduate that does want to get a certification, talk to me and I can walk you through the process. We're making a recommendation right now on that. And then for the HIT program, the appropriate certification for that is RHIT, Registered Health Information Technician. And as I mentioned the other day, this is only an associate's program. You can't get it any other way. You can't do diploma. It's just an associate's degree. And we are going through a process for certification with the certifying arm of AHIMA called CADIM. And what they do is monitor the quality of your materials. They also want to know a great deal about the school itself and faculty and services you provide. And then what types of training you provide, there's software as well as other materials, training, the whole 9 yards. In that program, we use a lot of AHIMA books and that type of thing. And we are close to finishing that process. It's been a interesting 2.5-year process so far, and we're not quite through with it yet. As I mentioned, we still have an on-site evaluation to complete. But once it is approved, then our students, graduates, everybody can go back and sit for this certification again. And we'll have a mock exam to help them prepare for it as well. And this is one of the 2 that we pay for, because it is looked on as really, really needed in the organizations like hospital systems that hire these people. And the appropriate next step for these students is a 4-year health information administration group program through AHIMA. So then they can sit for the RHIA certification. That's only available for bachelor degrees. This is the one our students will be eligible for. Make sense? Have confused you so far? Okay. And then for PharmTech, Pharmacy Technician Certification Board. And the program is truly designed around helping students be successful with the certification. And this is the other one we pay for. Because you have to be certified to get a job. And in most states, you have to be licensed. To get the license, you have to be certified. So it's kind of a catch-22. Some states, you have to have the certification before you do your externship. But I don't currently have students in those particular states. So where do we want these people to go to work? And it varies depending upon the organization. But for NBC, MAA, Moms, Healthcare Management, a lot of the organizations are very, very similar. Physician offices, billing companies, health insurance companies. And somebody asked me today, what about the selling health insurance policies? Well, I used to be an academic in physiology and medical terminology and maybe some information on the categories of coverage under insurance plans. But in NBC grad, I can get you any code 5 weeks of class, I can't guarantee that placement's going to count. Life insurance companies, not going to count. More than likely not, unless it's like an MAA. MAA maybe, but not NBC, because you're not dealing with claims and you're not dealing with code. So stop and think about that. If you want that placement account, is it the right kind of insurance company? Because Sue beats Tony up about that regularly. And then I mentioned your hospitals, especially for HIT prep. Their career potential income with RHIT, RHA certification after 10 or 15 years in the industry is phenomenal. We should have all gone through 30 years ago to go to work for a hospital. Because they're a great need now, especially as we move to ICU. The other thing I should have done was I shared some information with the management team yesterday. Things to know on healthcare. Should have developed an EMR, started doing it back in 1980 when I started working in the industry. There are only 4 people, families, on the Forbes 400 list of billionaires that are in healthcare. Only 4. One is the CEO at Epic. They only have 20-something clients, versus people like Cleveland Clinic and Kaiser. One is the CEO at Cerner. The third one is CEO of a company that provides the infrastructure for Epic. And the fourth is the Frist family. You know who the Frist family is? He's in Congress. But his family, and I think it's moved back to private. Okay, I could have lost track. It's been public and been private. I think it's gone back to public and private. HCA, sound familiar? Hospital Corporation of America. Of course, there is another hospital corporation that basically went out of business this week. You probably haven't heard of HMA Health Management Assessments. I live before they own 89 hospitals across the country. Well, they had to refund them $31 million to the feds for their electronic medical record money they took. If they found out, oh, we didn't even do that, did we? So they had to refund that, and then they've had other problems, so they've been bought out by community health systems. Things change daily. But outpatient facilities is relevant for farm tech. We'll talk about that in a minute, what our externship opportunities look like for students. But we also want to take into consideration students' prior experience, right? We talked about that, especially for healthcare management. MAA, I tell admissions, so they're working in the drive-thru at Wendy's. What does that tell you? What is their customer service attitude? They're on the phone at a call center. What's their customer service attitude? Really good customer service attitude. It's ideal for MAA. So what is their background, their experience? Where are they going to do well? Do they like analytics? Do they like digging? NBC. So those are the things that we try to take into consideration. But one of the things that most students don't think about is networking helps. And there are lots of opportunities out there to network themselves. And you can help them find these things. We'll talk about it in a minute. You can help them find some of those opportunities. To go on top of people who are working in the industry who may know about jobs in their area, so they can help themselves. One of those organizations where they have a huge amount of opportunities to network is the American Academy of Professional Coders. And you will find on this job site not just coding jobs. You'll find data entry jobs, you'll find billing jobs, you'll find front desk jobs. But the one thing you need to start with is tell them, get out there and network. Here in this area, local chapters exist in Brandon, Tampa, Clearwater, St. Pete, Newport Richey, Naples, you name it, Jacksonville, Orlando has a couple, Atlanta has 4 or 5, Dallas has several. Go to those local chapter meetings. Most of them are free. If they charge anything, it's like $5 because they have food that they're serving.